Do it like this itself. Every time it has the same issue of not changing. It is changing here, but it's not changing here. Visible now? Are the slides visible? Are they changing?
It's visible, but it's not changing,
Yes?
ma'am. It's not changing, ma'am.
It's not changing, huh? Okay.
Yes, ma'am.
Okay,
Changing, ma'am.
I'll go in this mode itself. Huh? No, in this mode it is changing, na?
Yes, ma'am.
Okay, I'll go like this itself. I can't help it. All right, so good afternoon, everybody. Today we have two topics to discuss. One is occupational safety, patient safety, and worker safety, and another one is training. Now, this I think is a elective module, if I understand it right. Occupational safety. Am I right?
Yes, ma'am.
Okay, what do you understand by occupational safety, or can I ask you what are all the hazards?
Goldie, your microphone is on.
Hello. What are the hazards that a person working in a healthcare facility will face? Yes, do you all work in the healthcare facility? Are you? Do you all work in a healthcare
Yes, ma'am.
facility?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
All of you work in a healthcare facility, right? What are your hazards?
Needle stick injury,
Okay, needle stick injury. Then
Exposure to radioactive substances,
exposure to radioactive substances. Okay, then
accidents,
accidents, exposure to radioactive accidents, and then what else do we have? Infections. We all work in healthcare facilities, and infections are the most common things that you will get. It can start off with a simple cold cough, which can be transmitted from patient to us or from us to the patient. Both ways it can happen, right? So we have so many hazards that are there in especially in a healthcare facility. You have chemical hazards, physical hazards, psychological hazards, biological hazards, and radiation, as you suggested. Now, what are these hazards? What is the risk that they have, and how can we prevent it? First one, what somebody pointed out was needle stick injuries. That means injuries because of sharps. What happens when there is a needle stick injury? What are the chances that it can spread any infections?
HIV,
HIV, hepatitis B,
hepatitis B,
C.
hepatitis C,
Sometimes malaria can also be transmitted, right? How can I prevent this from happening? How can I prevent or protect my healthcare workers from needle stick injuries or sharp injuries? What should I do?
immunization,
Immunization will not protect them from injuries. Immunization will only protect them from them becoming, if they are infected, it will protect them from further deterioration of that particular disease. Right?
proper
Immunization.
training,
Huh?
proper training to the
Yes, proper
healthcare.
training. Then there should be a policy. You will not use injections unnecessarily. And once the use of injection is over, there is no. What is the most common reason for needle stick injuries to happen?
Recapping.
Recapping. So you should have a policy that it won't be recapped. Once used, it will be discarded. Or even if you recapping should not generally should not be encouraged, right? And then what are the other methods that we can have? Can we think of any new kind of needles which the chances of pricking is very less? Can we think in that direction? auto disable syringes we have now, and even these there are certain syringes, there are certain engineering methods which can come up with measures so that the needle becomes blunt after one use, or there is a sheath that comes over it and protects it once the use is over or before the use, or some such kind of a engineering measures can also be used for us so that we avoid sharp injuries. Okay, what is the next most common hazard that we'll find in a hospital is of infections. What sort of infections can we get? There could be transmission of infections, na? Yes,
Droplet infection,
droplet infection. Okay, so that can cause what sort of diseases?
some respiratory diseases, ma'am.
Respiratory diseases, na? It could be
Yes,
SARS or even tuberculosis, or any respiratory diseases can happen. How can I prevent this from happening? How can I prevent any of the respiratory diseases from happening? Can I protect myself?
yes, ma'am.
Yes,
With
ma'am. By wearing
particular
mask.
mask.
By wearing mask, I can protect myself. Okay. Any other way that I can protect myself, so that just because, even though I'm not a doctor, but as a visitor, if I come to the hospital, I should not get infected to any of the diseases. How can I do that?
Proper hand washing techniques.
Proper hand washing. Hand washing will be by the individual person. Then what else can I look for? I can keep it, housekeeping is what we call it as. We can disinfect the floors, the most common areas which are being touched, so that even if there is any organism which has been there on those particular surfaces, it is cleaned so that it doesn't spread. Right? These are some of the measures which we can take so that the disease doesn't spread to others. Okay. Another most common ones after biological hazards are chemical hazards. We use a lot of chemicals in the hospital, especially disinfective agent, anesthetic agents are there. How to handle them to see that it doesn't cause any harm to others or to us itself. So for that, if possible, especially disinfectants, when it comes to disinfectants, can we see if we can replace the disinfectant with soap and detergent is one option that we have. For any chemicals, we have one thing: replace it with lesser toxic one. If it is equally good, say for example, glutaraldehyde is one, it is quite costly. At the same time, there are a lot of health issues that is seen in by the use of glutaraldehyde. Can I use something else? Can I substitute glutaraldehyde with something else is a question we need to ask ourselves. Okay, if there is possibility, substitute it. If there is no possibility, then what should we do? We have to have one protocol, in the sense only it will be used only in these places. Once used, it has to be kept back in its place, or only those people who are trained can use certain things. If there is a spill, you need to have written policies as to where it will be used, who will handle it in general, and if there is an accidental exposure to any of the chemicals, what needs to be done, who will be responsible, how to handle the situation. All these things should be explicitly stated in a policy, right? So these are some of the measures that we can take to see that, or we minimize the amount of occupational hazards that are there for our healthcare workers. That is up to chemicals. Then what next is the thing that we can be exposed to? Physical hazards. Anybody will talk about physical hazards in a hospital? Can you think of that? What are these physical hazards? Come on, somebody please tell me. What physical hazards can you think of in a hospital? I'm sure it is protected. So sun, wind, rain are not the ones that can cause hazard for a person in the hospital. What are the other things? What are the other physical hazards that you can see in a hospital? What do they do with the patients if they are admitted for surgery? Don't they shift the patients from one place to
While
another place?
shifting
While shifting, they have to lift the patient, na?
muscle
So when
strains,
you're,
sprains.
that can cause a back injury,
Yes, ma'am.
or it can cause some sort of other injuries, musculoskeletal injuries that can cause, not just the patient. Patient is very common for us, so we tell. There are other things also which are quite heavy that they need to lift if they have to shift or do anything of that sort. So that is one more hazards that we find in a hospital. Another one, what you mentioned was ionizing radiation. Radiation hazard is always there, especially when there are X-rays. So when there are X-rays or any radioactive isotopes that are being given to a patient. But when it comes to X-rays, can you all tell me what precautions are taken while taking an X-ray? Has
Lead
anybody got?
apron has to, lead
Lead
apron has
apron.
to be there.
Has to be there. Who will wear the lead apron?
Technicians and
Technician.
doctors.
Mm.
Sometimes
Technicians will. Sometimes
patient
patient
attendants.
attendants, if they are necessary,
Yes,
inside the
ma'am.
X-ray room, right? And what do they do? Ensure that only minimum it is minimally staffed. Only those who are necessary there will be there in the X-ray room. Otherwise, those who are not necessary and who are not involved are usually not allowed inside the room. Am I right?
Yes,
One
ma'am.
lead apron is there, so they try to minimize it as much as possible. And anybody working in radiotherapy or radiation medicine, they wear one dosimeter. Have you noticed it? They wear a badge kind of a thing,
Yes, ma'am.
that shows how much of radiation they have been exposed to. Suppose
Exposed.
their exposure is more than the permissible limits, then they are asked to stay back at home and take leave so that they can recoup for it. So the radiation exposure is reduced to a large extent. So those are certain measures that we take for healthcare workers. Healthcare workers can include from doctors to ward boys to all those who are included there. It is not necessary only for a doctor. Okay, these are some of the risks. And when it comes to physical hazards, that is lifting of patients or manually transporting certain things, there's something called as ergonomics. Ergonomics means, for example, you take even a chair. Imagine at what time the OPD starts. Usually by 9
9
o'clock it
a.m.
starts.
9
9
Yes,
a.m.
ma'am.
Morning 9 a.m., ma'am.
Morning. How long will it last? Till 1 o'clock.
Yes, ma'am.
Mostly one, right? From 9 to 1, a person has to be sitting only in one chair. The doctor, whoever is seeing, or the nurse, whoever is trying to direct the patients, are invariably either sitting or standing position, right? If they are in a sitting position, the chair has to be comfortable enough so that they don't land up in back pain. If they're standing throughout, for example, there is a surgery, right? There are many surgeries, especially transplant surgeries that can go on for hours together, 12 hours, 14 hours, isn't it? So all this time they keep standing and assisting the doctor. Not just the doctor, the other people also will be standing and assisting, na? So they also need certain, then they take turns in coming and having it, doing it. There are trained people. Only if you have that kind of a team, you will go ahead and do such surgeries. Otherwise, it is generally not advised to handle such surgeries single handedly. You get the point? So, for them also, you require certain ergonomics, in the sense the workplace should be so convenient that you should not feel the strain. The equipment what we use should be appropriate, so that even if the anybody wants to rest, the chair should be comfortable. It should not cause any pain, either back pain, or the posture needs to be maintained. So all these are some of the ergonomical issues which can be handled. Okay, if there is, and one more thing, if there is a person who already has a back pain, there is no point again asking him to bend and lift things, because it's only going to aggravate. Once that aggravates, this person will not come for the um, work, and again the work will get hampered. So sometimes it is better to give these people certain rest so that they can come back and work in a more efficient way. Biological hazards, we have discussed this in length. Now there are certain biological agents which can spread through blood and body fluids for people working in the hospital itself. For example, Nipah virus or Ebola virus. Once the patient is infected, from the infected patients to the nurse it can come, or whoever is taking care of the patient. So at that time what they should do, there's something called as barrier nursing, where they have to protect themselves using a personal protective equipment so that the infection is not passed on from the patient to the person who's taking care of them. Especially in certain places there are air conditions, central air conditions. Because of this air condition there are many types of pathogens that can spread in the air itself. So to prevent that, you can have negative pressure rooms, turning off the air condition to certain extent, and minimizing the patient movement from one place to another, so that the infection, if at all is there only in one place and it's not going across to other places. Most common thing that you have seen is use of mask and hand hygiene has to be cultivated everywhere. Now, look of risk, sharps, we already discussed. Chemical waste, I think we also discussed this here. And radioactive cytotoxic waste is to, the prevention of those hazards is to separately collect them and return to the suppliers, or use maximum protective measures for all workers. Now, what is it that an occupier should do? That means the administration of the hospital. What they should do in the hospital is to ensure there is a waste segregation and labeling that happens. There's pre-treatment of biomedical waste. There should be adequate and secure storage for waste. Transportation should be safe, and occupational safety in terms of vaccination of all the workers, and appropriate transportation and training on hazards should be given by the. And what are some of the bloodborne pathogens that we see? Among this bloodborne, when we look at the responsibilities of an occupier has to provide all these things. There are something called as the rights of the worker. What should a worker demand is that the workplace should be, they should have access to training, they should work on machines that are safe, they should be provided safety gear, and they should be protected from toxic chemicals and other hazards, and they should know where to report, and there should be a mechanism how these um, hazards are handled in a safe manner. These are some of the rights of workers. Now there's something called as guidelines and now when you look at bloodborne pathogens include hepatitis B, C, HIV, and malaria. So how do I protect myself from any of these things is try and see if I can eliminate it, or try and see if there are any engineering controls so that it is not exposed. There should be administrative controls in terms of policies, work practice controls that reduces the exposure of occupational hazards through behavior of workers. Now, what does this mean? In the sense, every worker who is working there in that environment should be aware of what sort of hazards this work will expose this person to, so that adequate, so that if there is anything, for example hand hygiene itself you take, everybody knows that hand hygiene helps in prevention of certain pathogens. It's a very simple procedure and everybody knows how to wash their hands. It's not that they don't know. But ultimately, when they're moving from patient to patient, most of the times what we have observed is hand hygiene is compromised. That means they don't wash their hands. So we need to have that kind of a practice or behavioral practice, changing the behavior of the person so that infections are not transmitted. For example, here hand hygiene is practiced. In certain hospitals, they take an audit, in the sense, in this department, how many times hand hygiene has been compromised, or who is not washing their hands. Is it the nurse, or is it the ward boy, or is it the doctor, or is it somebody else who's also there as a part of their team? So they specifically look for people who are not doing it. They call them and tell them that this is not the way, and once they will war, second time if they do the same mistake, they might use some other method, and later on they may even have some sort of a punishment if these policies are not complied with. That means if they don't follow the rules, then they may punish the people whoever is not following. This is just an example what I told you. And use of personal protective equipment is something which we need to practice. So every hospital, to provide worker safety and to reduce the occupational hazard of working in a hospital, needs to have follow or needs to follow or have personal either universal precautions. What is the fundamental thing in universal precaution? Anybody who knows this? What is universal precaution?
Taking
What does it mean by universal precautions? Yes.
generally spread of backbone pathogens.
Universal precautions means that I isolate or protect myself from pathogens. I am not isolating people, in the sense, if there is a HIV, for example, there is a hepatitis B patient or HIV patient in the ward or any other place. When you're approaching such patients, you protect yourself to see that pathogens don't enter your body by your behavior. You're not denying care to the patient just because they are positive for some bloodborne pathogens. You understand? You're protecting yourself from the pathogen and not from the person. Remember this. This is something what we call it as universal precautions. Now, this universal precaution can include personal protective equipment and other policies also which are associated with it, like use of heavy duty gloves or hand washing, masks, properly labeling it, having protocols in the sense, if there is a needle stick injury, there is a chance of infection that can happen. What should a person do when there is a needle stick injury? Whom should they contact? Suppose it has been a bloodborne pathogen is already there. Suppose the patient is positive for hepatitis B, and when you are doing a procedure on this patient, you have injured yourself, so there is an exposure that has happened. So what precaution, whom should be contacted? Is there an infection control nurse? Is there a physician who looks after such kind of activities? These protocols have to be specifically stated, and everybody who comes to the hospital, anybody who's working in that hospital should know, okay, if there is a needle stick injury, I need to report it to person X, and whatever that person X tells you to do, you will have to follow it. So that is something what we mean by protocols, and there should be a procedure for disposing of waste. Now we know that whenever there is something called as, whenever there is health biomedical waste that is generated, we know biomedical waste has its own hazards that are associated with it, isn't it? Agreed? Yes. What are the hazards associated with biomedical waste? You need to tell me. What hazards are associated with biomedical waste?
Ma'am, you need examples?
Ah, yeah. Give me examples. What will happen? What are the hazards that are associated with it? I'm giving a clue. One is needle stick
Like
injury. That
waste of the needles, waste of the
yes,
cottons,
yeah,
and waste of the operation machines.
yeah, operation machine. So there can be. Okay, now
Spread
tell
of
me
infection, ma'am.
infection. Then what else can be there with biomedical waste management? Anybody who's handling biomedical waste. One most common is the injury. Two is infection, and three is exposure to hazardous ionizing radiation. Sometimes in cytotoxic waste or radioactive waste will not come here. Cytotoxic waste exposure can also be there in biomedical waste.
Ma'am, infection can come from the used cottons,
Yes,
that means waste
infection.
cottons. I already
Yes,
mentioned that.
yes. It can be there. Used cotton also. Some if there is a cut in your hand and you are not wearing a gloves, there are chances that it can spread to
Yes,
you.
ma'am.
Okay, so those chances are there. So therefore you need to be aware of these things, right? uh, and the best way is to teach them how to protect themselves. And one more problem we have faced, or which you would have also seen, especially in workers who are handling healthcare biomedical waste, they may not really understand the implications of handling that particular waste with bare hands, and they will not end up using any personal protective equipment. When personal protective equipment is not used, you are exposing yourselves to lot of hazards that are there. Okay, so you need to be careful. You need to tell them that no, you have to use this. If you do not use it, you will be sick with something or the other, which may cure, or which there might be a treatment, there may not be a treatment. So you will be responsible for your own health. So, what is the most minimum approach for occupational safety that we can do here is we need to have implementation of standardized management procedures. Standardized in the sense it has to be uniform and it has to comply with the rules and regulations which is usually followed in most of the places. That has been proved. These procedures have been proved that they are protective. That are the ones those are the ones which we should follow. Standardized management procedures and vaccination against hepatitis B, provision of a place where the sharps can be discarded, universal precautions implementation, promotion of hand hygiene, and there can be allocation of additional role to assume responsibility for promoting better worker safety. Apart from looking after biomedical waste, you should also look at how you would be able to promote worker safety. Okay, so these are some of the things that we look at for. These are the most basic minimum ones to look for occupational safety in a hospital setup or in a healthcare setup. Any clarifications you have in this area? Because we move on to another one that is called as patient safety. Anything you would like to ask, or would you like to clarify anything in this area, especially in a healthcare setup?
Ma'am, please give some examples so that we
Example.
can.
Okay, now examples I told you, no, occupational hazards can include sharps and its injuries, can include spread of pathogens for us, can include what is that, exposure to chemicals. Okay, and if there is any physical hazard, say if you are uh, if you are standing or doing anything, it should not be painful to you. It has to be ergonomic. Okay, so these are some of the things what are there in the hospital. Even when you look at biomedical waste also, so it can be the patient or biomedical waste both put together in a hospital, what are all the occupational hazards that are there? And for these hazards, how will you protect yourself so that people working in your hospital will not fall sick just because they are working there? In simple terms. So to avoid needle stick injury, what you'll do, you'll give them a puncture proof container and ask them to put all the needles there. And you will say no question of recapping of needles. You will train all the people so that whenever they are handling sharps, they are very careful and see that they do not injure themselves or injure others with it. That is one mechanism. If there are chemicals that are involved, you can say these chemicals only trained people can handle, should handle. I'm not giving these chemicals to everybody or anybody. And when you are doing handling the chemicals, ensure there is adequate ventilation and you are wearing a personal protective equipment. That means the hospital should provide the worker with adequate personal protective equipment that is required for them, whether they're handling waste or whether they're handling patients. You get the point. Okay, so what do we call that? Protecting ourselves from the infectious agents, we call it as standardized precautions. Now, have I explained myself to you, sir? Are you satisfied with the examples I have given, or you want further explanations? Yes,
Yeah, it's good.
you understood.
Yeah,
Did you
ma'am.
understand, or is there anything else you were still having doubts? You understood?
No issue, ma'am.
No, no. What is the doubt you have? You tell me. You did not understand? Is
No,
there any? Huh?
I have doubt about the examination questions.
Oh, examination questions. They will ask you what what precautions that they have to take to prevent needle stick injuries, or what is injection safety. They'll ask you, okay, and what is minimum approach. That means if this is the minimum things that you have to do in a hospital to say it is occupationally safe. Okay. So next comes is your patient safety. If you can tell me a few questions, then I can tell you what needs to be written to this, written as answers. But I cannot specifically think of questions there. They may ask you what is
Yeah,
minimum
yeah.
approach for prevention of occupational hazard in a hospital. That is one question they may ask you. And what precautions are to be taken for safe injections? What is injection blood safety? What is injection safety? These are some of the things that can come across. All right, now there's something called as patient safety. Anybody who knows what patient safety is all
Ma'am,
about?
it means equipment of the safety equipments.
Yes, it also comes under this safety of the equipment. Say this one, what is that? A needle cutter. If it is too blunt and doesn't cut, and as a result you have an injury or a splash onto your face, the device
Use,
needs to be changed.
using scissors in operations during
Huh?
using scissors during the operations. It's
Yes, scissors during the operations. No, in an operation, all the equipment need to be sterilized. You cannot use anything and any sort of a device which is not sterilized in a theater, operation theater. Okay, now we are moving on to another thing called as patient safety. What is patient safety? Anybody who knows it?
to handle the patients carefully,
Ah.
patients health conditions.
Mm.
Okay, whatever the needs of the patients. Okay,
Mm. Mm.
uh, what patients communications.
Mm. Now the patient comes for one disease. Okay, say for example, the patient is having acute gastritis or acute gastroenteritis, is having vomiting and diarrhea. He comes to the hospital for an IV. Okay, in the process of starting him for IV fluids and replacing his fluid uh, electrolyte balance, it doesn't mean that you introduce some other pathogen into his vein because of not following aseptic precautions when you are giving a IV line. If there is a infection on the skin or a staph or some other infection that comes, you are getting that patient coming to the hospital is already diseased. On top of it, you are giving another disease because of your poor practices. One more thing, this happens very common when written instructions are not there. Something happens to the patient in the ward. The patient is having a pain. Instead of giving a painkiller, if the nurse or the attendant, whoever is there, takes the phone and calls up the consultant telling that this particular patient has pain abdomen, what should I do or what should I give? If the doctor tells something on the phone, but actually what is given by the nurse to the patient will be totally different, causing a problem to the patient. Instead of a painkiller, they may give something else. There's something called as like sounding medicines. The medicine contents are different, but they sound very similar. Okay, so always when you're looking at patient safety, it doesn't mean just about um, hazards or anything. It looks at lot of other things. It looks at communication to them. Interpersonal communications also would be there. Seeing that they are treated and they do not get any other hospital acquired infections because of the stay in the hospital. There is no mechanical injury to the patient when they are being transported. Okay, so and there has not been any medication errors. All these things will come under patient safety. Patient safety is an attribute of the healthcare system. Now, what is the objective of this patient safety is to prevent and control healthcare associated infection. You should not be introducing new infections to that person. For example, a person has undergone appendicitis. Okay, they have done a surgery, removed the appendix from this particular person. In the process, after the surgery, everything is over. The skin, the wound where the surgery has been done or where the skin is cut, if you find infection over there, we call it a surgical site infection. It means there is a compromise of hygiene somewhere, and aseptic precautions have not been followed. So for one thing, the patient will come, but he will take two diseases and go. So it is, if you buy one, another one is free. You have no buy one take one free or something like that. It will become like that. Okay, so if I really want to avoid such kind of things for patients coming to the hospital, now tomorrow if your hospital is like that, what will people say? Don't go to that hospital. If you go with fever, you will come out with something else. They will give you some other disease apart from what you have. So that should, you need to avoid that. For that to avoid, there are lots of things that you need to take care of.
Hospital
So first,
reputation,
yes,
yeah, the hospital reputation become down.
I didn't get understand you.
No, no, it,
Reputation, ma'am.
The reputation of the
yeah,
hospital
yeah,
will come down. Yes.
yes.
Yeah, that's what I'm trying to say. If you do not maintain patient safety methods or procedures, then the reputation will come down quickly. Nobody will come to the hospital then. So, how can I do that? What are the objectives? Is to prevent and control healthcare associated infections, to improve structural system to support quality and efficient healthcare, ensure that there are competent and capable workforce, strengthen the capacity for patient safety research. This is the objective of patient safety uh, for what it is being done. Now, how can I ensure patient safety is there in every hospital? Is I need to have patient centered standards, and there's something called as hospital accreditation. Have any of you been a part of National Accreditation Board of Hospitals, NABH or NABL, what they call it as? What does that mean?
Please repeat the question, ma'am.
Have you heard of NABH accredited hospital or NABL accredited hospital? NABL lab.
The hospital must
CMC Vellore is
meet
taken.
the basic needs, ma'am.
Basic needs. That means accreditation means what? There is somebody who will come and see what procedures you are following, whether whatever procedures you are following, you are documenting it or not. Okay. And
Yes, ma'am.
how best safety is ensured of all the people working in that place. It can be a lab or it can be a hospital. For a lab, we call it as National NABL, National Accreditation Board for Laboratories, National Accreditation Board for Hospitals. They have set some standards. Okay, they have set some standards, and according to these standards, they compare how your lab or your hospital is performed, is performing under based on those standards. Whether you have a particular procedure, whether you train all the people who come in newly to your hospital, have they been trained in all the disinfective procedures, do they follow hand hygiene? Okay, if all these protocols are followed, if there is somebody who has not followed these protocols, what do they do with them? Those also needs to be mentioned. Okay, so there are lots of things under NABH and NABL, but when you're following this accreditation process, what will happen is you will set the systems in place, and so that your hospital might be called as more of uh, safe. It is the occupational hazards are reduced to a large extent, and it is safe for people to work there and also seek treatment over there. There are certain set systems are in place, and the quality of care that we get in that particular hospital or that particular lab is good. So therefore, when it is something like what should I tell? Mm, in education, there are many syllabuses, right? State board you have, central board you have, CBSE, NCRT you have, and the ICSE you have. Are you aware of these syllabuses?
Yes, ma'am.
Yes. Now, what do you think of people reading in people who have studied in Kendriya Vidyalaya or any of the CBSE board, that is Central Board of Secondary Education, CBSE board? You find that maybe these people are better. I'm just using an example. It's not true. You will find everything everywhere. Okay. Uh, if you have certain syllabus or standards are set, if people who are following those standards, then you think, okay, these people are good in 1, 2, 3, 4, 5. Same is the case with accreditation. Okay. Now there are certain things called as adverse events. What are adverse events? Adverse events. Have you heard of adverse events following immunization? AEFI, they call it as.
Ma'am.
Events
Some
in
reactions.
hospital.
Huh?
Some reactions against to the particular drug or
Drug. It
immunization.
could be a vaccine or any drug. Adverse means it is something that is bad and it should not have happened ideally. Okay. So adverse events can be having an allergic reaction to severe allergic anaphylactic shock kind of a reaction to some drug, and it has not been checked whether the patient was allergic or not. For example, for a simple pain, people would have prescribed diclofenac sodium, isn't it?
It's a generic medicine, madam.
It's a generic medicine. It's a generic medicine, and they would have prescribed. But if they had asked specifically to the patient, "Are you allergic to diclofenac sodium?" before prescribing the medication, they are correct. but thinking that nothing will happen, and they prescribe diclofenac sodium. And if the patient lands up in an allergic reaction and dies, who is responsible here? Now, when you are asking whether you are allergic or not, what are you making sure? You are making sure that the patient, you know that you have looked in that particular aspect. Especially for antibiotics, many people ask, are you allergic to any of the antibiotics or any
No,
of the drugs? And only then they prescribe certain things. So you have taken care to ask the patient. If the patient doesn't know and it has happened, you're not at fault, because allergic reactions can happen. But even then, it is you are at fault. You should have given a test dose to find out whether the patient is allergic or not, and only then administered the drug. Okay. Sometimes with diclofenac also it happens, so we need to be little careful whenever we are prescribing. So that is an adverse event. When such events occur, what do you do? Is there a mechanism to find out how many such events have occurred, where they have occurred, who is responsible for it? There will be a mechanism to find out root cause analysis of it. What could be the reason for such adverse events to occur? And have you heard of Hospital Infection Control Committee?
yeah, there is a committee to handle everything.
Any infections in the hospital, what do they look for? They look for catheter involved infections, UTI. Because of a urinary catheter, there should not be an urinary tract infection that has been coming in any patient for that matter. Then they look for any uh, ventilator associated infections. They look for skin SSI, that is the surgical site infections, right? Among the hospital, and they'll also look for, they'll also take care that the water that is being used, the taps that are being used, the material that are being used in the hospital do not spread infection. Do you know water can be one of the source of infection even in the hospital? If the water is contaminated with E. coli, or it is contaminated with pseudomonas or any other organism, that can cause an infection. You wash hands with that water and try and think that your hands are safe, then what's the point? So therefore, even the water quality standards also need to be maintained. So these they look at the waste management also. So HICC's job is to see that the environment in the hospital is kept in such a way that infections are not spread from one person to another person, or infections are not caused because of the healthcare activities that are happening. An injection should not cause an injection abscess. Giving an injection should not cause injection abscess. That means what? Your needle was not sterilized, or the skin surface was not sterilized before giving the injection. So these are some of the precautions that we take for HICC. Now, has anybody read Checklist Manifesto by Atul Gawande?
Name can be heard.
Huh?
Atul Gawande name can be heard.
Atul Gawande is the
Ma'am, the
author.
book?
It's a book called as Checklist
Yes,
Manifesto.
yes, ma'am, I have it.
Okay, what they do in that checklist manifesto is that he has written a process how, our aircraft industry, na? Commercial aircraft industries, right? Indigo or jet or anything of that sort.
SpiceJet.
SpiceJet, whatever you take. You are taking a plane off and landing safely depends on lot of criteria. Every time a plane flies, they check for a lot of things before it takes off, and they have a checklist to find out, because you shouldn't miss out on something which is important. So therefore, what they do, they have a checklist, whether this is there, it is not there, if it is, whether it is working properly or not working properly, all these things are checked. The same thing, I don't know how many of you have had have heard stories about a surgeon operating on a wrong leg or an ophthalmologist operating on a wrong eye. Sometimes I used to wonder, is it really, can that really happen? Yes, it can happen, because if you are not careful of telling who that patient is, where the things have to be operated, they all appear same in the operation theater. I'm sure many of you would have had that experience, sitting in a theater there. So, if you have these checklists, identification of the patient is correct, identification of the surgical site mentioned, the patient has undergone pre anesthetic checkup, done, checked, the patient is allergic or something of this sort, all this checklist, whether there is a crash cart with all the things that are necessary. Suppose a patient, something happens to the patient on the table, if the patient is likely to bleed, is there blood over there, are there the appropriate anesthetic agents that are present there, is everybody from the surgical team there. So there are lots of such things which are necessary even in a hospital also, to see that. And here we are dealing with human lives directly, so therefore we should be all the more careful than what we are seeing. And so much of medication errors happen in the hospital. There are a lot more people dying because of medication errors rather than what you find people dying in accidents. So if we can bring in patient safety, you are actually reducing the medication errors that are there. Medication errors can include a wrong prescription, it can include a wrong drug or inappropriate dosage, all these things can be there. Okay, so there is something called as global patient safety campaign, which looks at safe injections, blood safety, safe surgical care, safe childbirth, safe organ transplantation, medicine safety, and medical safety device. Somebody was talking about medical safety devices. These
Operation safety,
devices,
ma'am.
hmm,
Operation safety.
that comes under safe surgical care. It comes under safe surgical care. That means what,
Okay.
before closing, then it includes, as I was telling, once they go into the OT, they should check. I was giving you the checklist now, whether, where is this, whether the patient has been identified correctly, and pre anesthetic checkup has been done, what sort of allergies has been mentioned, what is the type of anesthesia that are giving, where, what is it, at what time, who is the surgeon operating, all these things are there. And in the theater also, if blood is required, is the blood, what is the grouping, blood group that is required, blood grouping typing, these are very commonly mistakes happen. So for mistakes to be avoided, clear communication is very much necessary. Okay, and after surgery also, or all the mops out, inadvertently you cannot leave any mops inside the abdomen or any place where you are operating, or all the instruments intact. That is what an OT nurse is known for. They check for the instruments, they check for the mops, to see that whether the correct and nothing is left behind with the patient. If there is a drain, when is the drain needs to be removed, what is the care for the drain, when are the stitches going to be removed, all these things are documented, and the procedure is also documented. Your injection safety includes avoiding unnecessary injections, trying to prevent as many unnecessary injections as possible, and whenever you are giving the injection, the right dosage, the right route of administration, and safe disposal of all the, once the injection is given, safe disposal is something what you need to look at. Blood safety includes what? To see that whatever blood you are collecting in the blood bank is not infected. You check the blood for any blood-borne pathogens, and when you are transfusing it, ensuring that you are giving the correct group of blood to the right correct person. Okay, these are something what we look at as blood safety, where you are not taking blood from any professional donor. It has to be a voluntary donation only is encouraged. Um, and it has to be to see that the person who is donating blood is not having any bloodborne pathogens in him. Safe surgical care is what I was discussing. Safe childbirth would include all the cleans that are necessary to to be adequate care, to be ready with the neonate if there is any neonatal resuscitation that is required, to be ready with an ICU, to have an NICU to protect it, and to foresee the complications in a patient, and be ready for any eventuality that are there. Say if you are expecting any postpartum hemorrhage, be ready with blood to replenish it or any other method that is necessary. Safe organ transplant. Just because you are giving an organ, it doesn't mean that you can transmit any other disease associated there. You have to check the person for any bloodborne pathogens there, specifically hepatitis C. B is somehow you can immunize, but C, there is nothing much we can do. Safe organ transplant. Medicine safety. There are many medicines which are like sounding, and there are many chances that you may take. I'll give you my own my own experience. My son had some fever with cough. What the doctor had prescribed was erythromycin or some antibiotic. Azithromycin is what the antibiotic that had preferred. I went to the
Branded medicine, madam.
huh?
It's not a generic medicine. It's a branded medicine.
Azithromycin. Azithromycin is a generic medicine only.
What's azithromycin? Oh, it's a
Azithromycin.
yeah, it's a generic medicine.
Azithromycin. I went to the chemist, and I bought azithromycin. When I was at the chemist shop, I did not see the medicine properly. When I was about to give him, when I saw it, it was actually something else. It was a combination of metformin and some other drug. It's an oral hypoglycemic agent, actually. I don't remember the trade name of it. It was an oral hypoglycemic agent. So the dispenser, instead of giving me azithromycin, has given me something. If I had not known that this is not the medicine and blindly given it to my son, I don't know what would have happened.
Ma'am,
So
composition was same. Composition was same.
it looked similar. Composition was different because I know it was different. I could make it out.
I see.
So these mistakes can happen even while dispensing medicines. Also, you need to be careful. So that's why the best way for us to do is to get and one. So I heard something: iron and folic acid. Can this cause any harm to anybody? Usually,
Please
it
repeat.
doesn't.
Repeat, madam.
Iron and folic acid.
Usually won't happen
It
anything.
won't happen, but it depends on how you prescribe and what you tell to the patient. If you don't give that care to the patient and say please take iron and folic acid, you write 30 tablets and ask the patient to take. I don't know what the patient would have understood. If the patient has understood one tablet per day for 30 days, it is very good. Instead, if the patient thinks that I should take 30 tablets at the same time, what will happen?
Some side effects come.
Not side effects, the patient will die out of toxicity. Okay, so it is important for us, specifically in medicine safety, you have to write the prescription very clearly. Capital letters, how to take, when to take, how much to take. You have to be specific here. And sometimes what will happen, they'll have this preloaded, especially in a primary health center when there are a lot of people that are there, you will preload the syringe with certain medicines. Right, and if there is a communication back gap between somebody has not said what has been preloaded, they look in a different way. What will happen? They'll give a wrong injection to another person. This has happened many times. I mean, you will have had this experience. And when it comes to devices, faulty devices will all cause injury. So you have to be careful in. And one more thing important about medical safety devices is there are certain things which are to be used only once, and there are certain things which can be used more than once. Your OT instruments can be sterilized and used more than once, provided it is written that way. And there are certain things where they generally say it is a single use, specifically syringes and other things. So you have to be careful to know when to use which instrument can be used more than once and which instrument cannot be used more than once. You can have a policy of it and then decide accordingly. Okay, so there are a lot more things that are there in your module. You can go through it in detail and find out. What I have presented here is just the tip of the iceberg. There are lots of examples that are given which you can understand it better. Okay, right, thank you for a patient hearing. I will stop sharing. I think Dr. Lalita will take the rest of the session. You
Thank you,
have
ma'am.
another. Thank you.
Thank you, ma'am.
Thank you, Lalita.
Yeah. Good afternoon. Good evening, rather. You want a break or we do start simultaneously? Shall we go ahead?
Yes, ma'am.